Now, let's first talk about acute inflammation. Acute inflammation happens when there is an immediate response to a pathogen that can be a trauma, that can be due to necrosis. One of the most important things that you have to know here is that you learned about necrosis in the previous lesson, and what happens after necrosis is the infiltration of neutrophils and occurrence of acute inflammation in order to kind of get rid of those debris, dead tissues. Now, also foreign bodies can also cause acute inflammation and infection, obviously. Now, the goal of acute inflammation is to eliminate all of these pathogenic factors and also removal of necrotic cells, as I told you earlier, those debris that present in the cell, and also initiation of tissue repair. Now, mediators of acute inflammation, the first one is toll-like receptors, and they are mainly present in innate immunity system. What you know about innate immune system is that they are not as specific, and for example, macrophages, dendritic cells, and they are able to recognize PAMPs. This term stands for pathogenic associated molecular patterns. And what PAMPs are, they are actually all of those structure present on microbes, for example, and they have this specific shape that these toll-like receptors can recognize them. Now, one of those receptors, one of the classic example of that can be CD14 receptor that can recognize LPS and gram-negative bacteria. TLR or T-like receptors activations leads to upregulation of NF-κB, and NF-κB actually result in production of immune mediators. After activation of NF-κB, we have the flood of immune mediators, and that initiate the acute inflammation. Now, arachidonic acid also, which is released from phospholipid cell membranes, which has two types, and there are two pathways, and the first pathway is lipooxygenase pathway, and that occurs via the LTB4, which activates neutrophils, and also LTC4, LTD4, LTE4, and all of them cause bronchospasm, vasoconstriction, and increased vascular permeability. So you know that the lipooxygenase pathway leads to constriction of smooth muscle. So you know that in our bronchi we have the smooth muscle, and once these smooth muscle constrict, that leads to bronchospasm. Another one is vasoconstriction. You know, the wall of our vessels are covered by these smooth muscles, and these smooth muscles, once they are constricted, that leads to vasoconstriction. And maybe the question that you may have is that how this mediators or lipogenase pathway leads to increased vascular permeability. So what you have to know is that on the wall of our vessels, we have these specific cells that are called pericytes. You can see them here. The constriction of these pericytes leads to movement of endothelial cell, and that opens up the area that leads to increased vascular permeability. Also, cyclogenase pathway, which produces prostaglandin, which increase the vasodilation. And what you have to know is that whenever we are talking about vasodilation, we are talking about arterial vasodilation, and whenever we are talking about vascular permeability, we are talking about postcapillary venules. Now, PED2 is one of those prostaglandin that cause fever and pain. So PED2, prostaglandin D2 cause the fever and pain. Also, mast cells. So mast cells get activated when there is a tissue trauma, or when there is complement protein C3a and C5a, and these two proteins lead or cause degranulation of mast cells, cause the presence or occurrence of all of those inflammatory processes. And also cross-linking of cell surface and IgE. So you know that mast cell, they have these receptors on them, and once these IgEs are cross-linked together, that also causes the activation of mast cells. Now, leukotrienes, which is late mast cell response, leads to latency or the prolongation of mast cell response. Also, another factor is the Hedgeman factor, and that is when we have severe gram-negative sepsis in DIC. Okay, now let's talk about inflammatory reactions. Inflammatory reactions, they have these cardinal signs, and you have to know how each of these cardinal signs are formed and what are the factors that are causing the presence of these cardinal signs. So first, let's talk about redness or rubber. And rubber in color is the warmth that is caused in the inflammation process. And all of them are caused when there is a vasodilation, because that leads to pooling of blood to the tissue, and that makes the color red appearance of the tissue. And also once there is accumulation of blood, or when there is pooling of blood there, of course we'll have warmth. Now, mediators of these two cardinal signs are histamine. So, histamine is released mainly from basophils, platelets, and mast cells. Also, serotonin, that is released from platelets. Also, prostaglandins, which are released from leukocyte, platelets, endothelial cell. Bradykinin, that are inflammatory mediators. They cause increased vascular permeability, and also they cause the vascular dilation. And also they cause the bronchospasm. Now, nitric oxide, which are released from endothelial cells, they also cause vasodilation. Increased vascular permeability leads to tumor or swelling of the tissue. Now, inflammatory mediators of that are, again, histamine, serotonin, bradykinin, and also once there is a trauma or an injury to the tissue, there is endothelial injury. When there is an endothelial injury, there is endothelial cell necrosis, and that leads to detachment of these cells, and that leads to leakage of plasma content to the tissue, and that develops edema, and an edema causes swelling, because that's when there is accumulation of plasma content. Another cardinal sign is pain, and pain is regulated mainly by bradykinin and PGE2. And the last cardinal sign that we want to discuss here is fever. Now, fever mechanism is very important. What you have to know is that macrophages, the mechanism of presence of fever is via macrophages, and they release IL-1 and TNF. And IL-1 and TNF, it causes increased COX activity in prevascular cells of hypothalamus, and that rises the temperature, because PGE2 rises temperature, and that leads to the fever.